Hi, everyone, and thank you for joining us today. My name is Jonathan Rodriguez. I am the Health Programs Coordinator with the Hispanic Federation. May is Hepatitis Awareness Month, and today we have two doctors from Mount Sinai that will speak on hepatitis and treatments as well. And we will also have local agencies that will be sharing resources in events throughout the month. With that, we're going to start with our two speakers videos. And if you guys have any questions, please put it on the comments and we'll try to answer them. Thank you very much. And David, whenever you're ready, we can show Dr. Cohen's video.
I'm a professor of emergency medicine at Mount Sinai Beth Israel in Manhattan. And I'm also the director of the Emergency Department Health Education programs at the Mount Sinai, through the Mount Sinai Health System. Okay, so hepatitis in its most basic form is basically just inflammation of your liver. So ongoing damage of the liver. And the liver is an organ in your body that acts as kind of a cleaner, almost like a vacuum cleaner or a filter. So it cleans your blood and helps you get rid of toxic substances and also fight infection. Now, inflammation in the liver, hepatitis, can be caused by many things, including things like alcohol, toxic substances, some medications, and then some specific medical conditions. However, in the United States, the most common cause of hepatitis, the most common causes of hepatitis are viruses. And there are three very common viral causes of hepatitis in the United States. And those are hepatitis A virus, hepatitis B virus, and hepatitis C virus. There's also hepatitis D and hepatitis E. And those I'm not actually going to talk much about today, but those are two other viruses that can also cause hepatitis. Now, while hepatitis A, B, and C are all caused by a virus, the type of hepatitis caused by each virus is a little bit different. So hepatitis A is caused by the virus, hepatitis A virus, and it's spread by what's called fecal oral transmission. And most commonly when someone ingests food or water that's contaminated with the feces or stool of another infected person. Sometimes you hear about outbreaks in restaurants from contaminated food from a restaurant worker or contaminated water that's sprayed on different vegetables. So there's many different ways that you can get this type of contamination. Hepatitis A lasts from about a few weeks to a few months, and in rare cases can lead to complete liver failure, resulting in death, but most commonly it resolves on its own without any long-term repercussions. Now, hepatitis B, on the other hand, is primarily spread when blood from an infected person enters the body of someone who's not infected. So this can happen by sharing things that are contaminated with blood from an infected person, such as needles, toothbrushes, or razors. And about 15 to 25% of people who get hepatitis B go on to have chronic liver disease. The other people can clear the virus. Hepatitis C, like hepatitis B, is spread by infected blood. And in the United States, people who received a blood transfusion before 1992 are at high risk for hepatitis C because the blood supply was not screened for the virus prior to that time period. The other major group at risk for hepatitis C are those individuals who inject drugs. And more than 50% of people who get hepatitis C go on to have chronic liver disease. Now, in the United States, currently, the population that has the most rapid increase in hepatitis C are injection drug users, and this is due really to the opioid epidemic that we're seeing now, which got worse during the COVID epidemic. So in terms of symptoms, it's not uncommon for people who've been infected with any of these types of viral hepatitis to have no symptoms. If symptoms do occur, they tend to be vague and start anywhere between 2 weeks to 6 months after getting infected, depending on which virus you're infected with. And the symptoms that you get tend to be like any other viral syndrome, something like the flu. So these can include things like feeling tired, having joint or muscle pain, or having a low-grade fever. There are some more specific symptoms of liver damage, and these include things like nausea, vomiting, abdominal pain, particularly in the right upper part of the abdomen, dark urine, and then a yellowing of the skin, which we call jaundice. Although those types of symptoms are not that common with acute infection. The first thing I think to know is who should get tested and then how to get tested. So routine testing for hepatitis A is not recommended for most people. In cases where there's a potential outbreak and people have viral type symptoms, those people should probably get tested for hepatitis A, but it's not generally recommended for the population. Hepatitis B testing is recommended for anyone living in an area or coming from a country where more than 2% of the people are infected with hepatitis B. So these are certain areas in Africa and South America, and then certain populations or certain geographic locations in the United States. Testing is also recommended for people who inject drugs, men who have sex with men, pregnant mothers, people with chronic kidney disease, and those taking drugs that could suppress the immune system. And then anybody that has blood tests showing some sort of liver injury, those people should get tested for hepatitis B. The others should get tested for hepatitis B routinely are those with HIV. For hepatitis C, the current recommendation is that every single person over the age of 18 get tested at least once in their lifetime for hepatitis C. And groups that have continuing or ongoing risk for hepatitis C, like those who inject drugs, should get tested more frequently. In terms of how you get tested, well, the main thing to do is you should ask your doctor about testing. The test is very simple. It's just a blood test for all of these viruses, hepatitis A, B, and C. There's also a lot of emergency departments now that are offering routine hepatitis C testing. So if you go to the ER, you may get asked about hepatitis testing or HIV testing. And in those cases, if you haven't been tested previously, you should definitely get tested. So hepatitis in patients who are HIV positive, it's a similar disease in those who are not HIV positive. The only difference really is how fast the disease progresses to irreversible liver damage. So people who are HIV positive or people who have other conditions that suppress their immune system, their form of hepatitis is likely to be more severe and more rapid. So those people are more likely to go on to develop chronic hepatitis C, have ongoing liver damage, develop something called cirrhosis, and be at higher risk for things like liver cancer. Individuals with HIV also may be less likely to have symptoms associated with hepatitis. So I said before that you may get some general symptoms of a viral illness. Well, individuals with HIV may not get those symptoms. So it's recommended that patients with HIV get routinely tested for things like hepatitis B and hepatitis C more often than the general population. But the treatment for the disease in individuals with HIV is basically the same as those who do not have HIV. And the cure rates, at least for something like hepatitis C in patients with HIV, are the same as they are for individuals without HIV. So the treatment of the diseases and your chances of successful treatment are the same whether you have HIV or not.
Thank you, Dr. Cohen. With that, we're going to have our next speaker, Dr. Dietrich, speak on behalf of resources and treatments of hepatitis.
Dietrich, I'm the director of the Institute for Liver Medicine, Mount Sinai Health System, professor of medicine at the Icahn School of Medicine, the Division of Liver Diseases. Depends on which one you're talking about. It's important to note that actually this month is May, the National Hepatitis Awareness Month. And we have a new type of hepatitis that you might have seen in the news, the adenovirus hepatitis in children have started in the UK. And and 9 children in Alabama had it, and a few others are being reported. So that's a whole different virus from what we normally consider to be hepatitis viruses, which are A, B, C, D, and E. Hepatitis A is spread usually by food. It's a fecal oral method. So it never becomes chronic. That's the good news. And it rarely is fatal, although it can be at times, particularly in the elderly or in people who are immunosuppressed. Hepatitis B, that's the big one, B for big one. It's probably infected around 1 billion people worldwide. About 1 million people a year globally die from hepatitis B, and mostly from liver cancer caused by hepatitis B. The vast majority are in Africa and Asia, although it's a significant issue in the US, mostly because of many people have emigrated. The good news about hepatitis B is we can control it. We have 3 really good drugs, entecavir, tenofovir, and tenofovir alafenamide. But we can't cure it yet. We're working on that with multiple combinations of experimental drugs. But even better news is we can prevent it with a vaccine. Everyone who was vaccinated, who was born actually after 1991, should have been vaccinated, although the American College of Immunization Practices now actually recommends universal vaccination for hepatitis B. And therefore actually universal screening for hepatitis B. So we have actually instituted that using our electronic health record at Mount Sinai. So we're going around to all the primary care clinics and trying to get everyone screened for hepatitis B. If they're positive, referred to liver so we can treat them. And then if they're negative, they should get vaccinated. We have a really good new vaccine, 2 shots, 95% effectiveness, 1 month apart. It's actually a great thing. Now, hepatitis C for a long time was a real problem. It affects probably 5 or 6 million people in this country, and the numbers actually, unfortunately, have been going up in the last 2 years of COVID because of increased IV drug use, not down, even though we've treated over 1 million people and cured them. That's the big thing. So in the last 5 years, we have very effective treatments, oral medication, 1 pill a day for 12 weeks, or 2 pills a day, or 3 pills a day for 8 weeks, can cure 99% of people with hepatitis C, and that's truly cured. It's gone out of the body forever. Well, hopefully forever, although you can get it again. People can get reinfected with hepatitis C. Hepatitis D is for Delta virus, is very interesting. It actually cannot exist without hepatitis B. It's a very tiny virus, and it uses hepatitis B as its outer coat. And we're lucky that a new drug is on the way for hepatitis D or Delta. It should be approved in the US in October, and it's been approved in Europe for now about 2 years. So it seems to be safe and effective. The bad news about hepatitis D is if you don't treat it, it results in very rapid progression to cirrhosis and liver cancer in patients who have hepatitis B, of course. And then finally, at the end of our alphabet is E. Hepatitis E is very similar to hepatitis A, never becomes chronic, or very rarely, except for in immunosuppressed patients. And it's also fecally orally spread. You can get it from food. One of my patients got it from pork tartare. Actually, it's a very common virus in swine, and actually, so pig farmers are very commonly infected with hepatitis E. And of course, if you're eating raw pork, that's another risk for hepatitis E. There's really not a very good treatment for it, but it's similar to hepatitis A in that it almost always resolves on its own and is almost never deadly. Treating hepatitis C is easy. Like I said, 1 pill once a day for 12 weeks, or 3 pills once a day for 8 weeks. Honestly, the side effects are almost zero. We get a few complaints of headaches the first week with both medications. And honestly, that's really about it. It's almost zero. For hepatitis B, it's also 1 pill a day, virtually no side effects there. And, we'll watch people with hepatitis B every 3 months. For hepatitis C, we might see them 1 month after starting treatment, at the end of treatment, at the end of, say, 3 months. And then 3 months after stopping is called the SVR, the sustained virologic response. When we do that blood test and the virus is negative, at that point, we declare them cured of their hepatitis C. The only people that will require long-term follow-up are the ones that have significant fibrosis or liver damage, scarring. So we need to keep seeing them to screen them for liver cancer about every 6 months. Hepatitis C is eminently curable. Hepatitis A and E usually cure themselves on their own. We clear those easily. So hepatitis B is not curable yet, nor is Delta hepatitis, but we're working on it. Lots of people, lots of shots on goal there. A lot of people doing a lot of clinical trials. We have a really big support system, actually. We have a whole group of navigators and coordinators and a social worker that can help guide them through therapy, help them to get to their appointments, make sure they get their medications delivered on time. It's been very successful. Actually, we're very happy with this program. And they've also been actually actively engaged in getting all the positive hepatitis tests from the laboratory and seeking out those patients to make sure that they're getting treated. So we have a lot of support for patients with hepatitis. Yes, it's very important to be treated by experts. We have at the Institute for Liver Medicine, we have 7 hepatologists, 2 NPs, and 1 PA, all extremely experienced in all forms of hepatitis. So if it's easy to treat, that's not a problem. You can do that at your primary care doc. But if it's at all complicated, if there's significant liver disease, you really need to be at a advanced center like the Institute for Liver Medicine, so that you have all the resources available to look for liver cancer, to treat complications of liver disease, and to watch out for further issues that can complicate your liver. So we have a fantastic group of physicians and mid-level providers. And actually, we're backed up by a wonderful research laboratory as well that can provide us with lots of interesting data.
Thank you, Dr. and Monsignor, for providing this information. It's very beneficial for everybody to get checked and check the resources. For now, we're going to have our local agencies share what they're doing in their communities throughout this month. We work for the Hispanic Federation, as I said, and we don't provide direct services, but we do provide health insurance enrollment no matter your immigration status. You could visit our website or call us at 1-866-HF-I-DO-THAT. We also have other resources to share with you guys. So hope you guys give us a call for anything regarding immigration and other things that may affect you in life. With that, I wanted to go to our next agency, Dr. Lovely Joseph from Hone, that will share her information. Welcome, Dr. Lovely.
Hi, thank you, Jonathan. Hi, everyone. My name is Dr. Lovely Joseph. I am the clinical researcher coordinator for Hepatitis Outreach Network, HORN, for the liver division at Mount Sinai. What we do, we are a community-based free viral hepatitis testing and linkage to care. Under the leadership of Mount Sinai, we focus on minority communities who are at risk for hepatitis B or C, chronic hepatitis be, like we just said, like can give liver damage and everything, liver cancer and death. So we have this program when we develop partnership with community leaders, organization and association, wherever we can find people who are at risk, and we host screening event, um, and we have a linkage to care. If you are find positive, you'll have a follow-up visit at Mount Sinai. If you are negative, we have multiple centers where you can get vaccine. So on May 12th, we having open house at ASC African Services Committee, where we gonna have all day screenings, and you can take advantage of this opportunity to get your questions about hepatitis B and C answered, and then you'll be able to raise awareness about this disease. And also we have goodies, a lot of surprises from different agencies, HORN and ASC, and also the screening. You'll be able to get screened. It's free, and then you have linkage to care. The This part is really important for us. We don't only screen you, but we do follow up if you need vaccine or if you need treatment, and we can help you with that. We'll also have the documentation about hepatitis B and C, D, also what to do after, how to prevent, all those documents available. So we have our flyers for this event available. You will have that in the comment section as well. So on May 12th, we will be at ASC. The address is on 429 West 127th Street at New York. The zip code 10027. We will be there from 10 to 4:30. Please share the info with your friends and family, anybody you know in the Asian community, West African community. We speak French and different African languages and dialect, so we'll be able to serve you. I'm looking forward to meet you all. Thank you. Back to you, Jonathan.
Thank you, Dr. Lovely. With that, we're going to go to our next speaker, Luis from the Latino Commission on AIDS, if you're available. Welcome. We can hear you. Oh, sorry.
Thank you, Jonathan. Always happens to me. I don't forget the microphone. I'm Luis Mares from the Latino Commission on AIDS, Director of Community Mobilization Programs, and I'm here to share some resources that the Commission has. We have two parts. One where we provide direct services where you can be tested for HIV, hepatitis C, hepatitis B and A, and also other STIs. You can go to Oasis, which is located on 7th Avenue and 29th Street. Or also you can go to the main offices of Latino Commission on AIDS on 25th Street between Broadway and 6th Avenue. And also, we also work a lot in creating awareness in the Latino community about the effects of hepatitis, viral hepatitis on the community, in our community, Latinos. And we provide services both in English and Spanish. All the services that we provide are bilingual. So we can, for those immigrants, new immigrants that come to the country and want to be tested, want to know about hepatitis, they can come to us. And also can also go to the website that we have for Hepatitis Awareness Day, which is HispanicHepatitisDay.org. And you will see there are resources. You can download information, infographics about the impact of the hepatitis on the community, the Latino community. Also, we are going to have two webinars commemorating the National Hepatitis Hispanic Awareness Day. It's going to be on Wednesday, the 11th, and Friday, the 13th, at 2 o'clock. The first webinar is going to be delivered by Gus Law with the liver, and it's going to be about nutritional aspects on patients with hepatitis. And the 13th is going to be HepView. We're going to show a webinar about the impact of hepatitis in the community, in the United States, and specifically in the Hispanic community. And on the 15th, we celebrate with Sunday this year. We commemorate the National Hispanic Hepatitis Awareness Day. So I hope you guys join the webinars and participate and learn and ask questions. Or you can bring all your questions to us, and the presenters will try to respond as best they can. Thank you, Jonathan.
Thank you, Luis. Thank you for sharing that information. Next, we have Tasnim.
Hi, Jonathan. Thank you. Hello, everyone. My name is Tasneem, and I work as a registrar at the Hepatitis C Mentor and Support Group, HCMSG for short. We are a local organization that provides education, supportive services, as well as trainings. Our services include educational and supportive group development, harm reduction strategy training, advocacy training, individualized training sessions, as well as our circle model. Just recently, we've released a new training video that was designed to educate everyone on the risks of hepatitis C, the benefits of getting treated, as well as seeking treatment to get cured if you do happen to test positive. It's a short, informative video, and it's a great way to learn about the basics of hepatitis C. I believe we are going to share a flyer, which does have our link, and it is free for everyone to use. Thank you.
Thank you, Tasnim. And lastly, Joy from the Empire Liver Foundation will speak and share a video.
Hi, everyone. My name is Joy Canby. I'm a physician, and I am the program coordinator for Empire Liver Foundation. It's a consortium of liver specialists that are trying to expand the treatment base for both hepatitis B and C to increase the amount of care to address just how many people are living with hepatitis, particularly here in New York City. We have two different types of services that we provide, both online and on-site clinical trainings, as COVID allows these days. And we also want to take a leadership role in terms of advocating for more support and funding specifically for viral hepatitis initiatives, because as much as everybody knows, the COVID pandemic has fueled not only a rise in opioid overdoses, but drug use in general has complicated a lot of things in terms of getting new cases and rising cases of viral hepatitis. And now as we move on to this year, the viral hepatitis community has been particularly fortunate because we've gained a lot of momentum in terms of policymakers, both on the national, the state, and the city level. And we want to just allow this forum to create opportunities for others to get involved. I will provide sign-ons and petitions that we are actually looking to get help from many other organizations just to sign to say for their support for such services. And as part of the communications chair, we want to augment our voices and magnify just how important these health initiatives are and how great our work is to the rest of New York City. So now with that, I am going to attempt to share a video that I've created to show just the collaboration of all of our organizations and what we do in terms of education, training, clinical advancements, and in addition to working with health policymakers to make sure that the needs of our New York City communities are met. So let me see if I can share the video. Oop. Hang on 1 second. Can you guys see it? Uh-oh.
No.
Sorry about that. entire screen. Share. Can you see it now?
No.
No?
No.
Help.
Yeah.
Sorry. Hang on 1 second. All right. I put it in, let me see if I can download it now. Give me a second. Hang on. Share video file. I don't know if you guys want to, as I do the.
Yeah, that's fine. We're gonna have Luisa speak on some events that are happening this week, so she can share, and then we'll come back to you, Joy.
Hi, everyone. Thank you for having us today and being with us. So I wanted to share today some events that we're going to be having. We are going to be having on Wednesday, May 11th, a Twitter chat for hepatitis awareness. So please join us. We're going to be sharing those flyers with you as well. And then we're also going to be having a muscle dysphoria webinar that is going to be taking place Friday, actually, the 13th. We're also going to be sharing those flyers with you whenever David has a chance. So we would love if you come join us and share with us this experience. Thank you.
Thank you, Luisa.
Thank you, Jonathan.
Let's see if Joy, were you able to?
Sorry, can you hear me now?
Yes.
I'm seeing if it'll work now. Sorry, guys.
Okay.
It's not coming up. You guys can't see it, right? It doesn't.
No.
Hang on.
David, can we share the flyers while Joy is working on sharing her video?
I just wanted to also say we're all going to share our flyers as well through our Facebook page. So anyone that's looking for the events and locations can just go to our Facebook page and actually see the flyers there. So they're able to locate each agency that spoke today.
So we just wanted to recap on these flyers. So these flyers are just a recap of the events that we're going to be having. So please join us this is Friday, muscle dysphoria. And we're gonna have our Twitter chat on Wednesday, 1 to 2. We're also going to be answering some questions during our Twitter chat. If you guys have any questions, please make sure you put them in the comment. We'll make sure to get them answered. We also want to thank Mount Sinai and their physicians for providing that video to us. It is very beneficial that we make awareness of what hepatitis is, the different forms of hepatitis, treatment options, and yeah.
Joy, were you able still?
Are you there, Joy?
You guys hear me? Can you guys see my screen?
No.
Oh, damn it. Sorry, guys.
No, I can see. I just see your logo.
Can you guys see it now?
No. We see your logo.
Nice. Yeah, I just see you.
Yeah.
I don't know what's happening.
Well, what we can do, Joy, is we can share it. We can plug it into the comments. We can maybe also share it during our Twitter chat, correct, Jonathan?
Yeah.
Make sure that we have that available for everyone. If there are no more questions and everyone has their resources, we'll make sure that I wrap it up and give it to you, Jonathan. Just make sure that you have any last minute updates.
Sure. I just want to say thank you, everyone. Thank you for all the agencies that participated. And until next year, hopefully you have a successful Twitter chat. So we'll see you all on Wednesday at 1 o'clock. Thank you very much.
Thank you.